In the past 4 decades, childhood obesity rates in the United States have increased fourfold. Now, nearly 1/3 of children and teens are overweight or obese.
It's a potentially catastrophic problem in the United States. We have 9 million children who are overweight or obese. We're seeing type 2 diabetes, and we're starting to see hypertension in children. This is a terrible problem.
And in adults, obesity is at epidemic proportions. In 1991, no state had an obesity rate above 20%. Today, 38 states have adult obesity rates above 25%. 8 states have obesity rates above 30%.
We are mortgaging our nation's future by not dealing with this in a proactive fashion.
We have about 400,000 obesity-related deaths per year right now, so we're coming very close to that of tobacco.
Absent reforms, we will continue to see Americans suffer from over 60 obesity-related chronic illnesses, from heart disease to diabetes to hypertension and even cancer.
It's estimated that 14% of all cancer deaths in men in the United States are related to being overweight, and 20% of all cancer deaths in women are related to being overweight.
It's a perverted system. We treat their diabetes, we treat their hypertension, we treat their heart disease, yet we never treat the underlying cause of it all, which is frequently obesity.
And within the next decade, nearly 1 in every $5 spent on healthcare in the United States will be attributed to obesity and obesity-related conditions.
You know, the number one healthcare crisis that our children are facing today, it's not cancer, it's not accidents, it's not drugs or alcohol or smoking. It's the advent of childhood obesity and the early onset of type 2 juvenile diabetes and all of the consequences that flow from that. And we realize, too, that we truly need a comprehensive societal approach in this country to have any meaningful impact to address this issue.
This trend of rising obesity in the United States is reversible, but we must all act.
We set a very ambitious goal, and that is to end the epidemic of childhood obesity in a generation so that children born today grow up at a healthy weight.
It's going to take a team effort, the effort of communities, schools, families, and healthcare resources.
It's the schools, it's the parents, it's the mentors, it's all leaders. We all have a responsibility for our children.
We are calling upon mayors and governors and parents and educators, business owners and healthcare providers, anyone who has a stake in giving our children the healthy, happy future that we all know they deserve.
Find out what you can do to help stop obesity now.